When you think about taking a kid to the dentist, you probably picture smaller chairs, maybe some cartoons on the ceiling, and definitely a prize at the end. But what's really going on is a journey into a hidden world of science that's completely different from our own dental visits. So what really makes a pediatric dental visit so unique? It's way more than just managing a smaller patient in a bigger chair. The entire scientific approach, from psychology to the actual anatomy, is built on a totally different foundation. So let's pull back the curtain and see what's really going on.
All right, first things first, this is not just adult dentistry that's been shrunk down. We're talking about a completely different philosophy of care. It's one that's built around a child's entire developmental journey. Yeah, the official definition calls it an age-defined specialty. And that's really the key. It's not just about fixing a toothache that's bothering them today. It's about guiding a child's oral health from the moment their very first tooth pops through all the way into their teenage years. It's a long-term relationship.
And this is a great way to visualize it. It's called the pediatric treatment triangle. See, with adult dentistry, it's pretty much a two-way street, you and the dentist. But here, it's this constant, dynamic, three-way conversation between the dentist, the parent, and the child. And look who's right there at the top, the child. Every single decision, every action, it all revolves around them.
So with that philosophy in mind, let's step into the exam room. A pediatric checkup is kind of like detective work, honestly. And the first clues, they show up before the dentist even asks them to open their mouth.
This is what's called the extraoral exam. So the investigation outside the mouth. The dentist is checking for facial symmetry, gently feeling the neck for any swollen lymph nodes, watching how the jaw moves. They're looking for these really subtle clues that can point to anything from a breathing issue to a bigger developmental concern. It's a total body check-in. And then the investigation moves inside the mouth. And again, this isn't just a quick hunt for cavities. The dentist is looking at the soft tissues, the cheeks, the tongue. They're checking the gums, the way the bite fits together. It's a full-on assessment of the entire oral ecosystem before they even zoom in on the individual teeth. Now, let's just say that during this exam, the dentist finds it. A cavity on a primary tooth, what we all call a baby tooth. And this right here leads us to one of the most common and, frankly, one of the most dangerous misconceptions in all of dentistry.
You've heard it. Maybe you've even thought it. Who cares? It's just a baby tooth. It's gonna fall out anyway, right? That single idea, it is responsible for so many future dental problems. Because the truth is, these little primary teeth are absolutely critical.
They are multitasking like you wouldn't believe, doing 6 critical jobs all at once. I mean, sure, there's chewing, but they are also essential for clear speech development. And look at this, they are perfect little placeholders, guiding the big adult teeth into exactly the right spot. If you lose one of these too early, you are basically setting the stage for crowded, crooked, permanent teeth later on. They are not disposable. They are the architects of your future smile.
And get this, their physical structure is completely different. A baby tooth isn't just a tiny version of an adult tooth. Not at all. The enamel is thinner. The nerve inside, the pulp, is much, much larger and way closer to the surface. So, what does that mean in the real world? It means a small cavity can become a big, painful problem incredibly fast. So, given all of these unique challenges with their anatomy, how do you actually go about repairing one of these teeth? It's definitely not as simple as just using a smaller drill. It requires a whole different way of thinking. Okay, the biggest challenge is the shape. A baby molar is literally bell-shaped. It bulges out near the gums, and then it gets narrower at the top. So just imagine trying to get a filling to lock into that shape without just popping right out. It's a serious engineering problem on a tiny scale.
And before any of that precision work can even start, the dentist has to solve a huge logistical problem first. I mean, how do you create a sterile, totally dry workspace in the mouth of a curious, wiggly kid? The solution is surprisingly simple, but wow, is it effective.
It's called a rubber dam. It's basically a little sheet that isolates the tooth they're working on, creating a perfect, clean workspace. This gives the dentist a crystal clear view, it protects the child from swallowing anything, and, this is a big one, it cuts down on those infected aerosols by up to 99%, making the air safer for everybody in the room.
Now, look, it's not perfect. It can be a little tricky to place, especially if a tooth isn't all the way in yet. And yeah, it definitely takes a little bit of extra time and some good communication to get a kid comfortable with it. But for most fillings, the massive safety and quality benefits make it the absolute gold standard.
So with the area all prepped, the repair work begins. And this is where it really looks like miniature engineering.
Every single cut is designed to work with that bell shape, not fight against it. The dentist has to keep the filling narrow to keep the tooth strong and control the depth to within a fraction of a millimeter to avoid hitting that big nerve that's sitting just below the surface. It's incredibly precise work.
But what happens when the decay isn't small? What if it's already reached the living core of the tooth, that very vulnerable pulp? In adult dentistry, this might mean a full-blown root canal or even losing the tooth. But in pediatric dentistry, there's another amazing option.
It's called a pulpotomy. And the goal here is pretty heroic: save the tooth. The dentist carefully removes only the infected part of the nerve from the top chamber of the tooth, but they leave the healthy nerve tissue in the roots totally untouched. This stops the decay right in its tracks while keeping the tooth alive and functioning. It's a rescue mission.
After that, a special medicated dressing is placed over the healthy pulp to protect it. There are a few different materials they can use, but the most modern ones, like something called MTA, are biocompatible, which basically means they encourage the tooth to heal itself from the inside out. And look at that success rate, over 95%.
So why on earth go to all this trouble for a tooth that's just going to fall out anyway? Well, this quote right here gets to the absolute heart of it. Cavities in baby teeth are a powerful predictor of cavities in permanent teeth. Taking care of this first set is the single best investment you can possibly make in the health of the second set. And that's really what's so amazing about this. We've just unpacked this incredible hidden world of complexity, all inside a single baby tooth. It really makes you wonder, doesn't it? What other parts of our own health, things we take for granted every single day, are just as complex and just as important, waiting right there for us to take a closer look?